Debbie with Cultural Alignment Solutions, and we are here today with the Expansion Factor podcast. And I am super, super excited about our guest today. It's Dr. Mike Deninger. And let me just say, he is everything I am not. I absolutely love everything that he does. We're going to try to get into everything that he does today. Mike, I don't even think I can begin to explain all that you do. So I'm going to let you actually introduce yourself here in a moment. But on today's podcast, we are going to do what we always do. We are going to talk about how you have expanded in your life, your leadership, your love, whichever one you want to take us in this conversation. So I am honored that you are here with us today.
Right. Thank you very much. It's nice to be here.
Yes. So go ahead and tell us a little bit, or as long as you want, who is Mike? How did you get here? What is it that you do?
So I will give you the shortened version.
Okay.
All right, good.
I'll ask questions though if I need to know more, right?
Well, you're welcome to do that. It's your podcast. So
Okay.
yes, working class family. I was fifth out of six children. And so I grew up lower middle class, middle class. Always the best little boy in the school, and so on and so on and so on. I was always, it was always easy for me to attain what I wanted to attain. And so I didn't have to work very hard until I got to graduate school, actually. But what I did not know that there were some issues in my childhood that were unaddressed. And I did not know that until I was at Deninger University. I was in my early 40s. And I was a working alcoholic. So around that time, I think I was 45 maybe when I stopped drinking, stopped smoking. And that was something that was like hereditary in my family. Everybody kind of went that route and either stayed in it or got out of it. Luckily, all of us got out of it, all six of us, and we're all still alive. So after about a year of sobriety, I took a downturn. I went into a deep depression. I got very anxious. I had phobias about bridges and tunnels and heights. And I was agoraphobic in cars when somebody else was driving, and I had no idea what was happening. Luckily, I had a great therapist. And this is somebody who I would say is a model for me in all the work that I do. And he's still working out there, which is great. And he walked me through what became a PTSD diagnosis from childhood sexual abuse. I had memories of these events, but not complete memories of them. I'll give you an example. When one day my dad went across town with me and my brother and two male cousins, to get some coal because we needed coal to heat the house. And we were all on a trailer and came back to the house, and we were shoveling the coal into the coal bin. And my brother turned around with the shovel and he nicked my cousin just above the eye, and there was a lot of blood. And then there was a discussion, do we go to the hospital? What do we do? That memory stayed prominent in my recollections for all the years until I got sober, and then continuing after that. What that was connected to was a time when I was abused in the coal bin by my father. So that's kind of in a nutshell. And there were other memories, but so at 45, as a dean at the university, and I was a national figure in education of deaf children. My name would have been known in every state for the work that we were doing. I was heading up two laboratory schools at Gallaudet, one elementary school and one high school, which were national demonstration schools that were funded by Congress and still are. And after that crash, and coming out of it, I decided to change. And that was the most significant event in my life. I started making arrangements to leave administration and to do some other kind of work. As I was in therapy, I was also taking a master's in counseling. So I described myself as a living laboratory at that time. I was learning about trauma in the books, and I was not sleeping at night and was able to tell you exactly what it was like. Um, so after about 18 months, maybe 2 years, I came out the other end. And although I had always been a compassionate social justice activist kind of person, that became center stage. And so I moved into trauma work, established a private practice. And for the last 23 years now, I've been working as a trauma therapist, then an author, and now a trauma trainer who has developed an eye movement therapy called multi-channel eye movement integration. It's a sister technique to EMDR, but it's much simpler, faster, and gets results that are durable. I know this from my experience as a survivor.
Yeah.
And in fact, before I found the therapist that really led me through PTSD, I was all of the traditional therapies were used on me, like cognitive behavioral therapy, exposure therapy, EMDR, and I was frustrated by the therapies. And when it came time for me to begin treating other people, I knew that there had to be a better way. And so that was probably the biggest expansion in my life right at that moment. And there may have not been one specific moment, but over time in that period, I learned something called eye movement integration. And it came from neurolinguistic programming field. Two innovators back in 1989, it was right after Shapiro introduced EMDR. And they criticized Shapiro because EMDR in its earliest form was an NLP technique. In the book that I wrote in 21 about MEMI, we call multi-channel eye movement integration MEMI, I go into some of the history related to that and how the earliest form of EMDR was in fact had several NLP strategies and structures that came before EMDR. And in fact, Shapiro was a trainer of NLP. She knew about the eye movement model that NLP used in its early days. And so there's a lot of information out there. And one very recent article by a guy named Gerald Rosen, who writes about Shapiro's history before she created EMDR. So eye movement integration was a much simpler technique, and it was NLP based, unabashedly NLP based, whereas Shapiro said EMDR had nothing to do with NLP. I learned that in 2002, and I was blown away by the results that I was getting. I knew from my survivor instincts that this was different. The only problem with eye movement integration was they never developed written procedures for it. It was taught in 1 or 2 day seminars, like most NLP techniques. And in about, I think it was 2008, I thought about developing the procedures myself. So I took the kernel of eye movement integration and I talked with the developers and got their permission to expand it. And that's what led from 2008 to 2021 to the publication of multi-channel eye movement integration with all the bells and whistles that you would need for a traditional clinical therapy. But the good news right now, and this is a big expansion for me in the last 2 years, is that we now have forms of MEMI that are being taught to coaches, hypnotists, and NLP practitioners. So there's one online course that you can take And then there's a coaching process after that. There's 10 consultation hours that leads to MEMI certification from MEMI International for that class of providers. And the reason for that is because, 9 million people about live with PTSD at any given time in the US. Only 50% of them have access to mental health care. And if they do have access to mental health care, they probably will have a hard time finding a trauma therapist who's really skilled at their work and one who doesn't use the traditional therapies. The reason why the traditional therapies don't work, well, they do work, but it takes a long, long time. We're talking cognitive behavioral therapies, according to the American Psychological Association, take 15 to 20 sessions to get a reduction in symptoms, not to cure PTSD. Okay. So unfortunately, the model that the mental health industry has developed for PTSD calculates effective therapies as the ones that reduce symptoms. But they don't evaluate how many people actually do not have that diagnosis anymore. Or if they do evaluate it, it's in the back of the book or, in a footnote or something like that. Mm-hmm. So those therapies, cognitive behavioral therapy, cognitive processing therapy, prolonged exposure, written exposure therapy, they all ask clients to repeat their trauma story over and over again. That's systematic desensitization, right? You start at the bottom with the least offensive and you work your way up over and over. What happened next? Close your eyes, think about it, and tell me what happened. This is extremely hard for survivors. Yeah, I get a little emotional twinge when I think about that, right?
I'm going back to my own therapy sessions.
Yeah.
Woo!
So that was one of the reasons why I felt a strong urge to promote this kind of therapy, because MEMI is sensory based. Most of the therapies I was just talking about are what they call top down. They're cognitive based. They ask you to give me a thought about you in relation to the trauma, right? And they're looking for what we would call a negative self-assessment. Mm-hmm. I'm weak. I should have done something to stop it. I'm embarrassed. And then they try to move that cognition over to a more neutral or positive one. It wasn't my fault, for example. Okay. EMDR does that in a very specific way. So they start with a negative self-assessment. They ask for a desired self-assessment. How would you like to think about this, instead of what the negative self-assessment is? And then they test and retest. After the eye movement sets, they test and retest. How close are you to that ideal cognition, right? Mm-hmm. Mm-hmm. We don't have to do that. We don't do that at all, in fact. Wow. We're not a cognitive therapy. It's all sensory based. So instead, I'll ask for a thought in the beginning, like one classical video that I use in training. The woman said, "It's my fault. What happened?" But I don't say it's irrational or you really should change that thought to a more positive one. Let's work on that. We just leave it alone. We write it down. Then we ask, what's the image? Okay. And then we ask, okay, is the image in color or black and white? Movie or a still photo? Is it fuzzy or clear? Is it near or far away? None of these therapies use that kind of sensory baseline data collection. Sounds, there are sounds. What are the sounds? Mm-hmm. You don't have to tell me exactly what it is. Tell me if it's loud or soft. Is it high pitch or low pitch? Is it kind of rough or smooth? We ask them about the physical reaction. Where do you feel a reaction in your body when you think about that? Well, I have a tightness in my chest, or I've got a knot in my neck. And we scale each one of these, 0 to 4. How intense is that image for you? 4 is the highest, 0, no intensity. How intense is the sound? How intense is that physical reaction you have? And what emotion do you connect to that memory? Are you okay?
I am, yeah, I'm following every single thing that you're doing. It's like, wow. Yeah, I'm probably going to call you after. Well, you guys got to do this one-on-one.
I cannot divorce myself from the tools of my trade because I was watching your eyes and I see them getting a little misty. And so that's why I asked you the question. You're okay though, right?
I am okay. It's yeah, I'm feeling this conversation. Wasn't expecting to feel it this deep. But I appreciate this. I appreciate the work that you do. And yes, I am okay. I'm going through yet again another leveling up and transitioning in my own life. And so the past probably 2 to 3 weeks, I've been on a journey myself, right? We're never, as long as we're living and breathing, we're always expanding something, right? It's what are we expanding? So I appreciate this. And no, I'm being serious. I will probably follow up with you after.
Well,
Keep going.
this is exactly how our therapy is different. And it's, I don't call it only a therapy. It's a method for NLP people to use, for coaches to use, because if somebody has an active trauma in their life, or one that they think that they put to bed, but it still brings up emotions, then it needs to be addressed. Because that is, in my metaphoric imagination, that is sucking out some of the bandwidth that they have to do what they want to do, what their vision is, right?
Yeah.
So to get back, we also ask about the emotional reaction and we scale it. And then we have 4 specific sets of eye movements. And I won't go into detail about how they got developed, but there is a structure that led me to develop these 4 sets of eye movements. We don't do more than 4. EMDR might do as many as 15 or 20 in one session, right? And they're focused on the cognitive aspect, right? What's it like now? What's your thought about that now? We just do an eye movement set. Then we ask them to engage the image again and tell me, is it the same or different? And typically people will say, well, it's different. How is it different? It's farther away. Oh, it's farther away. You know, I always react with wonder or curiosity. It's farther away. Does that make it better or worse? It makes it better. So you gave a 4 in the beginning. What score would you give that image now? It's down to a 2. Okay, 2 is moderate. Okay. And we scale each one of those sensory areas. And then we do use what's called a subjective units of distress scale. That's that 0 to 10 scale. We set it at 10 at the beginning. And we set it at 10. We don't ask them, where are you right now? Which is the way the set is usually used. Well, how would you score it right now? We say it's at 10 as we begin, because that's the way that you always react to this memory every time you think about it. Right? When I think about a traumatic memory, I get the same reaction every time until or unless time wears it down. Or we do some intervention that is going to resolve it, right? And so the goal in MEMI is to get that score down to 5 and your 0 to 4 scores down to 2s. Usually they go down to 1 or 0. Okay, and we can be talking about the most dramatic and heinous kinds of events that you can imagine. So this, I stake my reputation on this. I do not promote anything that I cannot demonstrate in live audiences with a volunteer. And so where we are right now is scaling up what we have. The method, the protocol, the theory is all in place. And we have we have webinars, on-demand webinars for counselors and mental health people, for the NLP and coaches and hypnotists, and a new one, which is fantastic, for first responders.
Oh, wow.
First responders in municipal settings and in the military and police departments have what are called peer-to-peer support networks.
Okay.
This is their way to respond to the mental health issues that are endemic in these types of careers, right? Because of what they have to face on the job.
Yeah.
The problem, and we have a trainer named Brian Simmons in Texas who is former police himself. He is an EMDR trained therapist who was doing EMDR for 10 years. He learned MEMI from me, and he has now developed a training program for these peer support specialists who are policemen or fire workers themselves, or even people who work with human trafficking victims. He's training them the MEMI protocol, and they are using the protocol with their peers in these peer support networks with a lot of support from us. So, and we have a research project that's just getting underway between Brian's operation. I'm involved somewhat, but Brian is the principal investigator, if you will, between HC Solutions is his business in South Lake, Texas, and Stephen F. Austin University. They are the researchers, and they've done a lot of research with first responders. So we're next week starting to collect data, and we're looking forward to proving what I'm confident will be an evidence-based
Yes.
therapy.
You already know what the outcome. Yes.
Yeah. My experience, my instincts tell me this is really something.
Oh, wow. This is exciting. Very exciting. I have a few questions just in you sharing all of that. Yeah, I don't even know where to begin. Because I want to make sure that we cover how people get in touch with you. Can people do sessions with you? Is it via Zoom? Does everything you do live? All of that's coming up. Certifications? Is it Zoom? Is it live? How do they reach you? All of those types of things I'm highly interested in. So tell me what does it look like to work with? If I come to you and say, Dr. Mike, I'm a coach. I want to plug into you. What can I do with you? What does that look like?
Okay. So there's plenty of information on the website that there's an 80-minute introduction to MEMI. So you could watch that for free. It's both on the website and then our YouTube channel. And that shows videos, it shows you the protocol, and you will see dramatic results with a woman that I worked with.
Okay.
So you would, if you're interested, you would take the course that's appropriate for you. If you're a mental health person, you take the clinical course. It's a webinar, and you pay, I think it's less than $400 for the course.
Wow.
It's on demand, so you work through 15 or 20 modules. You take a quiz at the end of the course. You pass with 80% or better, then you get the certificate. And then you're in line for the 10 consultation hours. And these are group consultations. When we have a group together, either I or one of our trainers will go ahead and do the consultations. And during that time, you will be practicing in the beginning with maybe family members or friends who are willing to work with you. Mm-hmm. At the beginning, not on serious trauma work. And you get your feet wet and you find out how it really does work. Mm-hmm. And then over the 10 sessions, which are usually about 2 weeks apart, maybe a little bit more, you learn the practical applications of MEMI with substance abuse, with phobias, with different kinds of issues that people encounter. And this is a technique that you use when people are stuck as well. So if you're coaching somebody and they have a feud at work and they get very destabilized by it, and they can't regulate themselves, this is a technique that will calm the memory of that and allow them to be free of the sensory reactions that they have in relation to it. And the thoughts will adjust on their own.
Yeah. Yeah.
The woman I mentioned who said, "It's my fault," at the end of the video, she said, "It's just an unfortunate thing that happened." And I didn't have to ask her all the way along. I said, "Do you remember the thoughts you had in the beginning?" She said, "No, I don't." And I told her, and I said, "What's your thought now?" And that's what she said.
That's awesome. That was going to be something I was going to ask you because you're right. And I remember back my years of therapy, and it was like, oh, we got to go over this again, which I didn't even realize that was the technique. I was like, oh, we got to talk about it again. It's always felt like it was pulling back. And this was years before I became a coach. And that's what fascinated me about coaching. Of course, I became a coach way back in the beginning days of, your certification of
Of
coaching.
coaching, yeah.
Yeah.
After the consultation hours, there's certification. So
Okay.
you've completed everything that you need to complete, and you apply for certification as a coach, a MEMI certification as a coach or hypnotherapist,
Yeah.
and pay $100, and your certification is
You have
awarded.
that.
Yeah.
That's awesome. Yeah. I like that the coaching side or like it's about the forward. How do we get people also to move forward, right? When they've been through something so traumatic. You mentioned that there's 9 million people that have PTSD right now, give or take, in our country. And only half have access to wellness or was it therapy programs or different
Clinical, yeah. Clinical
clinical programs.
therapy. Yeah.
What comes because my love and expertise comes into the corporate arenas where I work, and I talk to a lot of leaders that are stuck because I'm not just about hitting goals. I'm not about that type of coach. My leadership coaching comes from inside out leadership. How much of this do you think? Because I'm trying to run math in my head of it. There's 9 million. How many of those are sitting in leadership roles, right? That actually have these internal traumas that they're bringing in to their leadership.
A lot. I'll tell you a quick story about how I know that. I was
Yeah.
coaching a group from Australia online, right? And these are all therapists. One of the guys, we were talking about phobias. One of the guys said, "I kind of have difficulty when I go into big arenas, right? I can't sit in the middle. I have to sit on the edge because I have to be able to get out." And I asked if he wanted to do a demonstration with me. And I said, sometimes we look for what I call emotional imprints that might connect to, a current issue that somebody has. Doesn't always happen that way, but in his case, I said, "Do you remember the first time you ever had that feeling of needing to get out?" He said, "Oh, yeah, yeah. I was 8 years old. I was under the house. My dad was telling me to do something, and I got stuck, and my dad swore at me, said, 'You stay in there and do what I told you to do.'" And when he started telling that, he started to flush and he started to have difficulty breathing. He had just told us that he had put that to bed, that it wasn't a problem for him anymore, right? So we did MEMI on that, and he started to be able to think about that memory without the reactions, the breathing, the physical reaction, and the emotions
Yeah.
and everything like that. So even somebody as advanced as that, he does trauma work. That's what he does. But he was unaware of the connection between his phobia and an event of a long time ago.
That is so powerful. It's so powerful, especially when you all of a sudden realize, whoa, that triggers me, right? Just to be able to get to that point of recognition of, and that, in all honesty, and this is why I think it's awesome that I'm meeting you right now. That's what I've been sitting with these past couple of weeks. And it's funny, in the beginning, you were talking about like when your chest tightens and things like that. I've started again to cycle back and go, okay, I'm triggering. And you did the two places this week that I've been going, okay, what does this one mean? What does this one mean? And I ended up having some memory around this one, but yeah, it's powerful. As long as we're living and breathing, Mike, we always have something, Dr. Mike, I'll call you, we always have an opportunity to literally just continue, right? To be
Mhm.
into what those are. Let me ask you this. All right, so corporate settings. I'm going to keep it about corporate, but take it as personal or stay wherever you want to go with it. What? How would you introduce this into a corporate setting, right? To me, a lot of times when we work with corporate, they think, oh, that stays over there, doesn't have the place in here. I feel very opposite to that. I feel that having these resources to actually normalize the reality that chances are on either side of you is someone is sitting that has been through a trauma. And how do we give that space, that opportunity, and those benefits to bring that in? How would you introduce that to somebody if they asked you, seriously, Mike, why should that be here?
Yeah, well, I've certainly heard that before. And,
Okay.
remember, I was a corporate head for quite a while, so
Yep. In the
I would,
education realm, right?
yeah, I would start with the word resilience. There's a lot being written now about resiliency, and it's a kind of a soft approach to trauma, but it frames it as when we have a trauma, our whole system is in dysregulation, right?
Mm.
So we have protective responses because our amygdala is overreacting whenever we're threatened. There's hard science that, we can look at the amygdala, and when somebody is thinking about a problematic memory, their amygdala is going like this. And when we do eye movements, and this has been done in laboratory settings, the amygdala calms down. As
Mm.
long as they're thinking about that problem, the amygdala calms down. So there are a lot of people who are in limbic dysregulation, and that's the result of the trauma, right? So if you have people who are have limbic reactivity,
Mhm.
then you want to move them to resiliency, where they are free from that problem area and they're more expansive.
Yeah.
They have more resources, they have more flexibility, and they're able to attune to the tasks that you want them to do in your organization.
Yeah. Yeah.
And you're going to cut down on the feuds between people
Mhm.
because people will get triggered by each other,
Yeah. Yeah.
unaware that what's happening is causing them to trigger.
Yeah. It could just be what, like the way someone's behaving or a word they might say that could actually trigger somebody else.
Yeah, or look,
Wow.
yeah.
Wow. Yeah.
In polyvagal theory, they believe that the two mechanisms that decide our dysregulation are social interactions. And when that means that if somebody looks at you like, right,
Yeah.
that's a dissenting kind of look, that can trigger an emotional reaction. And also, so it's yeah. So it's that plus sensory reactions. So
Yeah.
if you get that tightness in your chest at the
Mhm.
same time that you're getting a social cue from somebody else that's threatening, that's going to determine how you react. That's going to determine the level of distress that comes out of you.
Yeah. Yeah. That's powerful. I have a friend that is labeled, she calls it B PTSD, and the B at the beginning stands for business PTSD, which is so, while it doesn't relate to people that have been through like significant traumas, her teaching behind it is in business. So many times things happen to people that break trust. They break, and once you break trust, even in a team setting, and then these organizations want us all to work as team, it doesn't work. And so that is where my brain is even starting to go as to it's not just a matter of, hey, let's have a team building activity and make everybody be friends. If trust, I'm talking true trust, was broken in some form or fashion, I see things like what you do and what you bring as very much a part of just building it versus just words. Does that make sense? I don't think it's
Yes,
transactional anymore. I think people have really connected. This is a whole self journey.
right. So it's replacing just the idea. So team building is a cognitive exercise, right?
Yes,
Yes.
yes,
So it's taking the cognitive paradigm out and it's putting in a sensory paradigm and it's
yeah,
saying, okay, the way that we have reacted as humans since we were, cave people, right,
hmm
is we had to evolve and we had to run faster to keep ourselves safe. We had to figure out how to get food. And when food was not available, we had a lot of distress.
yeah,
And when we figured those things out, the brain modified, right?
mhm,
But what didn't change over all of those eons is the fact that our chief factor for staying alive is the limbic system's response to threats to our beings,
mm,
right? And that's the reality. If somebody pisses you off at work, and you decide you're going to cut them out of the picture, then
yeah,
there's distress and there's
yep,
limbic dysregulation, and you're not going to work together. But if I understand that I'm having this reaction because of that event, I don't want this reaction.
right.
How can I get rid of it? Ah, let's do some mind movements, and you can desensitize that memory and then decide, do I engage with this person or not? It doesn't affect me anymore because I let go of it. That was his problem, not my problem.
Mm, that's powerful. So I have a question for you.
Yeah.
I could sit and talk with you all day. All right. So someone is, let's say they've worked with you or someone that's certified, whatever. So they've gone through the exercise because our brains have a wonderful way, and you've got to help me from your perspective of knowing. So I'm learning. What happens if a thought does come out? Like, what is there any type of tool or something you tell them to do if it happens? Like, do you set them up? Does that make sense what I'm asking?
Yes, yes, it does make sense. So you're talking about the thought as the key instigator of a difficulty,
Yeah.
okay? And this comes from cognitive therapy,
Yeah.
that
Okay.
thoughts determine our emotions and our
Our
physical
actions.
being.
Yeah.
This is top down.
Okay.
So if you're using a cognitive model, then you would say, okay, do something like they describe it as thought stopping. Okay. So become aware that you have these thoughts and they're counterproductive and stop the thought
Mm,
and have a redirection to a different thought. So that's called thought redirection. So I'm not going to keep thinking about that. I've thought about it 5 times this morning and I want to let it go.
mhm.
But we pay more attention to what's happening to them physically because if we can change their reaction, in their body and the imagery related to it, then the thought is going to change on its own and they're not going to be having
Yeah.
these intrusive thoughts come up all the time.
Yeah. Wow. That's amazing. So what if you're in a situation, we work a lot, in all honesty, with female employees. There's a certain industry that we work in, and it's a male dominated, which is great because I work with males and females, but it's male dominated. So a lot of times we'll end up coaching the females because confidence tends to be an issue. Walking into the room, owning that job title, being able to present, and then they're scared after death. I can't go in there. And then, of course, all the gremlin, all that stuff. Do you even work in those types of, will this help in those types of situations with
So
people?
absolutely, there are two
Okay.
ways to address that. The first would be to ask them to identify the most egregious situation that they were in where their confidence was challenged and where they felt put down
Okay.
or whatever. Okay. We start at the top of the food chain with the most egregious one. We don't start at the bottom and move up. Because once you desensitize what's at the top in that particular memory, let's say I'm thinking medical field, you said male, I'm thinking medical. So doing rounds, and some woman who asks a question of the lead male is put down in front of her peers and patients, right? So the one that's the best example of that, we ask them to tell me about the image, tell me about the sounds, tell me about the physical reaction, and we do the eye movements, and we will desensitize that memory. Okay. At the end, we do a future rehearsal, and that is for the next time it happens. So if, for example, they're going into an interview, next week, and they're terribly anxious about it, what do you think it's going to be like? Tell me about the image. Tell me about the sounds. Tell me about your physical reaction as you're anticipating it now. So this is what we call anticipatory anxiety. Okay. And you can do an eye movement technique on that future situation. They become more calm. And when they actually get into the situation, they're more resourceful.
That's cool. That's so cool. So cool. So powerful. I have loved this conversation. We're not done. That's all I'm like, I could just sit here and talk to you all day. This has been amazing. As we wrap up, are you willing to do a little game with me with my word cards?
Oh, absolutely. Yes.
All right. All right. So I am going to draw a word card. These are all my cards. So all I do is I just randomly draw. All right. And here we go. We have one. Oh, I'm going to give you this word or phrase. I'm going to show it up here in just a second. Whatever comes to your mind Dr. Mike, take as long as you want and tell us what this means to you. It's making a difference.
Oh, wow. It means everything to me. Everything. So I've come to believe that my role here in this iteration of my life is as a catalyst for change. I have done diversity work when I was a dean at the university. I marched with Martin Luther King in Selma when I was a freshman in college. I can go on and on and on, but that is something that is primary for me.
So does it surprise you that out of a stack this big, that
Not at all.
it tells me a lot about you and that you are on this planet to make a difference. I cannot tell you how grateful I am that the universe brought you and I together right here on this date,
Wonderful.
this time. I know, it's amazing. I am going to let you tell the guest anything you want to say. How could they reach you? Of course, I know I'm going to be popping it up all in here and links will be down below that they can get. But is there anything else you want to say before we wrap up today?
Yes, the website where people can go, I'm going to give you the short version. It's mylastname.com. So Deninger, DENINGER.com is the MEMI website. And my email is DRMIKE, Dr. Mike, LPC, licensed professional counselor, 7546 at gmail.com. Awesome. So that's how you get in touch with me. I don't do a lot of client work anymore, although if I do, it's on Zoom, but I do make referrals.
Absolutely. And then that website is where they can go if they want to check out the certifications and all that process. And then you have the team that actually does all that.
That's right.
Thank you. I am just honored to have met you, to have done this today, and to be in your presence of making a difference in this world.
Oh, thank you, Debbie. Thank you very much.